Okay, let's unpack this. Today, we're diving deep into, well, a really critical connection, diabetes and frailty. And frailty, what is that exactly? It's more than just getting older, right?
Right. It's a state where your body's physiological reserve, kind of its backup power, is seriously depleted. This makes older diabetic patients especially vulnerable.
Had it. So, less resilience. And our deep dive today is based on well, a really significant piece of research.
Yeah, a bibliometric analysis, basically a study looking at hundreds of other studies on this topic. Ojim and colleagues looking at over 400 articles.
400.
Right.
Wow. So our mission is to really equip you with the key insights from this field.
And what's really fascinating, I think, is how frailty is being seen now. It's not just an age thing anymore. It's increasingly recognized as a novel complication of diabetes itself.
A novel complication, so specific to diabetes.
In many ways, yes. And this view, it really changes things. It seriously impacts prognosis. We're talking higher risks of disability, more hospital visits, and sadly, higher mortality, too.
That's huge. And it sounds like the research community is really waking up to this.
Absolutely. The interest has just exploded if you look at the number of publications.
Right. The analysis showed that surge since about 2017.
Exactly. A huge jump. We're talking a 17.77% annual growth rate in research papers. That's fast.
That really signals a major shift in focus, doesn't it? It's not just old age anymore.
Definitely not. It's being seen as something potentially preventable, manageable, within the context of diabetes care.
And geographically, is this research happening everywhere?
Well, it's heavily concentrated in developed countries right now, the US, the UK. The UK is actually leading in terms of influence.
Interesting. Any key players driving this?
Yeah.
Specific researchers or institutions?
Yeah, the analysis highlights Alan J. Sinclair as the most prolific author in this specific area. And institution-wise, the University of London comes out as a major hub.
Okay, so with all this activity, what are they actually focusing on? Where's the scientific spotlight?
Good question. So, key hotspots right now. One big one is understanding the complications within frailty, like sarcopenia.
Sarcopenia, that's muscle loss, right?
Significant muscle loss, yeah. It's a core part of frailty, loss of strength, loss of function. It's not just about appearance.
Makes sense. Well,
Epidemiology is another big focus, figuring out who gets frail. The global prevalence in older folks with diabetes is around 20.1%.
1 in 5, wow.
And it seems to be higher in women, interestingly enough.
And I imagine the impact on just, well, day-to-day life must be immense. Quality of life.
Oh, absolutely. Think about it. Managing diabetes is demanding already. Checking blood sugar, meals, meds, frailty makes all those simple tasks incredibly difficult. It hits self-management hard.
And it's not just physical, is it? The research mentioned cognitive aspects, too.
Yes, that's a crucial link. Frailty seems to impact cognitive abilities. There are emerging connections being studied with dementia and mild cognitive impairment.
Which, again, makes self-care even tougher, a real challenge.
A huge challenge.
So, okay, we know a lot more now, but where are the big frontiers, the cutting edge? What are researchers wrestling with right now?
Right. Well, one major frontier is definitely diabetic kidney disease, DKD.
Ah, kidney disease. How does that link with frailty?
It's a complex, kind of a two-way street. Having DKD seems to increase your risk of becoming frail, but then being frail can actually make the kidney disease worse, or at least harder to manage effectively.
A vicious cycle, then.
Exactly. They're really trying to unravel that bidirectional link. And like we touched on, cognitive impairment is another major area, getting a lot of focus now. It shows how I need to look at the whole patient.
Definitely. So bringing this all together, what's the bottom line for our listeners? What's the practical takeaway?
I think the most crucial point is this. Frailty assessment needs to become routine. Even though there isn't one single perfect tool, a gold standard, we need to be looking for frailty in older diabetic patients regularly.
So screening for it is part of standard diabetes care.
Yes, because that assessment is key to guiding truly personalized treatment plans. We need to move beyond just focusing on A1C or blood sugar numbers alone.
Right, looking at the bigger picture.
Yeah.
And you mentioned personalized plans. What kind of strategies does the research suggest? How do we make care more tailored, especially when things get complicated?
Yeah, personalized needs practical steps. The research points to things like simplifying medication regimens. Polypharmacy, taking lots of pills, is a big issue.
Okay, so reducing the pill burden where possible.
Exactly. Also, really focusing on reducing the risk of hypoglycemia, low blood sugar. Falls and confusion from lows are much riskier in frail individuals.
Makes sense. Anything else? Tech, maybe?
Yes, potentially using tools like continuous glucose monitoring, CGM. That gives a much richer picture of glucose levels 24/7. It allows for more tailored adjustments, maybe less finger pricking, just more adaptive care overall.
So this deep dive really highlights how diabetes isn't just about blood sugar, is it? It's deeply woven into overall health and aging.
It really is. And the way research is growing, especially into these complex areas like DKD and cognition, it shows a real shift, a necessary shift towards more holistic, patient-centered care.
So the final thought for you, the listener, how might actively bringing frailty assessments and this kind of truly personalized care into practice actually change things? Especially thinking about regions where maybe this research focus is still emerging and access to these approaches might be more limited, something to consider.